So my name is Dario Ramalho, and I'm an infectious disease specialist. So it's a very important question. The conditions that a patient must have before being discharged is having at least for 48 hours up to 72 hours not having fever. Another very important criteria is to have its transaminases measured regularly and having them below 1,000. It is not as important to have the patient with low levels of bilirubin. Focus on the transaminases, especially TGO. Obviously, you need the patient to be clinically stable. So usually, if the patient fulfilled the criteria for having a hospital discharge, he's already stable, but he might present on a later time, sometimes 4 to 6 weeks after discharge, a late onset hepatitis. So it is interesting to see them up to a month and follow up regularly with them every month perhaps, or at first with 1 month, and then 3 months, and then 6 months, which was the protocol that we used to see those patients. And then if you follow up all of them, you might encounter some cases of raised bilirubin levels and raised transaminases levels, which are a reactivation of sorts of the yellow fever, a late onset hepatitis, which is a very benign form of this late yellow fever, and you should not biopsy those patients. So the usual follow-up comprehends the usual exam, the clinical exam, plus some basic lab tests in which you will focus on the hemogram, plus kidney function and liver function. By any means, this is a very benign form of the disease. It is part of the healing process of it. So in those situations, it is important to vaccinate patients when you are not certain that what he had was actually yellow fever, so as not to have a patient re-exposed to yellow fever, an unvaccinated patient re-exposed to yellow fever. That's one precaution that you should have in those areas. So if the patient, if you have a confirmation of that case, that he actually or she actually had yellow fever, then he has lifelong immune protection, and that's not a concern anymore for him, for that specific patient.